It looks to me like we have Miranda on. I don't see Patty or Christine or Arthur or Rosie, but let me know if I'm missing someone. I had just emailed them the new Zoom information, and so I'm hoping that nobody is having trouble connecting. I think we should just give it another minute.
Sure.
Camille, have you talked to Arthur this afternoon? Because I did send him an email earlier today too. He was confirming.
Yeah, him and I have been emailing in the past 30 minutes. He's the one that reminded me of it. So he'll be on. Did Shirley retire?
Yes, ma'am.
Okay, and who's the new person for her?
That would be me. I'm Erin Vickers.
Okay, Erin.
And I'll drop my email address in the chat for you.
Okay.
It looks like Christine has joined us. Welcome, Christine. We're still waiting on a couple other TAC members. We'll give it one more minute. Christine, did you have any trouble because I had sent you two separate Zoom links? Or did
I actually was so busy reading over the notes, and then I saw you emailed like a few minutes ago, right?
Yeah.
And that's the one I used, the recent one.
Good. I just hoped it hadn't caused any confusion.
I didn't see a link in that same stream.
I had put it on a calendar invite and it was an old link for some reason. I went to the TAC page today and it was different. So I updated everything. Well, while we don't have a quorum at the moment, which is why I was waiting to see if someone else was going to join us. What we could do, since we do have a pretty packed agenda, is go ahead and skip approval of the February minutes and have go down to one of the new business discussion items about certified professional midwives. And then we can revisit the minutes after that. And I don't want to forget doing introductions. I'm Emily Beauregard. I'm the director of Kentucky Voices for Health and the chair of the Consumer TAC. And I believe Miranda and Christine are on. And if you all would like to introduce yourselves, that would be great. And I'll keep an eye out on the participant list.
Sure. I'm Miranda Brown with Kentucky Equal Justice Center and a member of the TAC.
I'm Christine Jackson, and I am volunteering with AARP.
And Arthur has joined us. So Arthur, if you can hear us and unmute and start your video, then I believe we will have a quorum and we'll be able to go ahead and approve the minutes.
I'm representing PNA and LA and SA. Oh, and as a.
I can see
A consumer.
Oh,
A consumer of Medicaid.
thank you.
Thank you.
Thanks, Arthur. So we do have a quorum, and why don't we go ahead and take a look at the February minutes. Let me know if there's any changes that we need to make before I motion for approval.
I did not see any necessary changes.
Okay, thanks, Miranda. And I guess I should say take a motion for approval.
I can make a motion. I am motion to approve the February
Thank
minutes.
you.
I second him.
Thank you, Christine. All in favor, say aye.
Aye.
All right, motion carries. Thanks very much. So we are going to skip some of these top agenda items and go down to item number 6 under new business. We have a guest with us today, Mary Catherine DeLauder is here to talk with us about certified professional midwives and specifically making sure that these CPM, certified professional midwives, are Medicaid reimbursable. So Mary Catherine, if you wouldn't mind giving us just a little bit of background, and then we can open it up for questions at that point.
Sure. Thank you very much for the time to speak to everybody today. I represent a group called the Kentucky Birth Coalition. It's a grassroots consumer advocacy organization that started around the year 2012, working to make the type of midwives called certified professional midwives eligible to be licensed in Kentucky. Midwives are a type of provider that attend births. So they provide prenatal care, so sort of similar to the way an obstetrician would for someone who's pregnant, but they provide a little bit different style of care. And midwives only work with people who have no complications in their pregnancy, who are healthy. There are different types of midwives. We have another type of midwife also in Kentucky, certified nurse midwives, which are APRNs. They mostly practice in hospital settings. So you might see them in the same places you would see obstetricians. And we also have this type of midwife that our group worked on getting licensed, which is certified professional midwives. And they are not nurses, so they are just midwives. They typically work not in hospitals. So this would be home birth, people that want to have their babies at home, or also in birth centers that are not part of a hospital, which we don't have any of those currently in Kentucky. So basically we're talking about people that have their babies somewhere not in a hospital. There have always been people that have had home births, and there have always been midwives attending those births. And the profession of midwifery has changed over time. And certified professional midwives is sort of the standard credential for those midwives that attend births outside of hospitals. So the people that are having—
Can I interrupt you for just a second? If you're not speaking, can you please mute? We're getting a lot of really loud feedback. And so that way the court reporter can make sure to capture what's being said, please. Sounds like there's a drill in the background somewhere.
Thanks. And Erin, it may be possible for you to mute people if you're the host. Sometimes that works in Zoom and sometimes it doesn't.
I have a mute all button, so I'm still trying to figure out how to mute individual people, but I just wanted to, because I can hardly hear her. So I just want to make sure the court reporter can get everything she's saying.
Thank you.
Thanks, guys.
I'll make sure it's not coming from my end as well. Has it changed, or has it gotten better, or is it different?
There's not as much feedback now, so I was hearing
Okay.
a lot of background noise, so we should be good. Thank you.
Okay.
And I didn't mean to interrupt. I apologize.
No, thank you for saying something, because I can't hear it on my end. So I've also got a toddler here with me, so she likes to join me on meetings sometimes. So
I don't like it more.
just a minute, honey.
I don't like it.
In
I
2000,
don't like it more.
give me just a moment. Toddler happy, and then I'll continue. Sorry about that. So from 2012 to 2019, we worked on getting these providers licensed, and the end result was that we got a law passed in 2019 to license CPMs, certified professional midwives. There are currently now 30 licensed in Kentucky. The licenses are issued through the Board of Nursing, even though they're not nurses. That's just the organization where the legislature put them for administrative purposes. And since that time, since the licenses have been issued in 2019, or starting in 2020, really, it took a little bit of time before they got everything set up to issue the licenses. We've been talking with Department of Medicaid Services about trying to get CPMs to be able to be eligible Medicaid providers. And
Come over here, do it. Not you.
and
You
to no avail. Give me one more one moment. I apologize. The fun stuff from working from home.
Oh, hi, this is Jason. Let me try to help Mary Catherine, that I will not be able to do as well as she can, because she knows these issues better than anyone. But well, we did pass a law in 2019 for licensure and for certified professional midwives. The Board of Nursing started licensing midwives, I believe, in 2020, and we've been working on Medicaid providing. Okay, Mary Catherine's back now. I don't, but just wanted to fill in a little bit, Mary Catherine, there for you, trying to help.
Thank you, Jason. Nothing worse than an upset toddler in the background. So
We have all been
didn't
there.
want to hear that either. So, so now that CPMs are licensed, we've got a lot of consumers who would like to be able to have them as their provider for their pregnancy and for their birth. And they're not able to accept Medicaid. And so we've got people who have chosen, who wanted to have that type of a care provider, and they didn't choose to have a CPM because they weren't covered by Medicaid. Or we have people who went ahead and did have a home birth and paid out of pocket, even though it wasn't covered by Medicaid. And we've heard from tons of people who have been in all of those various scenarios. And now that these providers are licensed in Kentucky, the consumers, it was really a consumer-driven effort to get them licensed, because it was the consumers who wanted more availability for this type of provider. And recently, the nursing TAC actually discussed this same topic because it's sort of not clear where this would fit as far as what TAC might bring this topic up. And so someone that was newly appointed to the nursing TAC talked about it because, as I mentioned, the Board of Nursing ended up being the administrative body that is regulating CPMs, even though they aren't nurses. And then also the consumer TAC came up, since this is a very consumer-driven effort and there are consumers that wish to have these services covered. So that's kind of it in a nutshell. I can answer any questions about what CPMs are or what they do or type of services they provide, but it's essentially about people wanting to have choices in where and how they have their children. And this is a very safe, effective choice. And we want people to have these options because we think that more options improves all outcomes when we have more options.
Yeah, thank you very much, Mary Catherine. And I'm glad you brought this issue to the consumer TAC, because, you know, when there are consumers out there, you know, requesting these types of services, it's something that we should know about. And I think certainly something that we want to make sure that Medicaid is aware of. And so I'm just curious to know, I know you've had conversations with staff at DMS, and just curious to know what the status is of those conversations. And this is something, you know, maybe you can tell us some of the steps that you've taken and conversations you've had, but I'd also like to hear from DMS staff as far as, you know, sort of where this is in the process of being approved for Medicaid reimbursement.
We, Jason specifically started communicating with different staff members even before the bill was passed to license the CPMs about trying to be proactive in planning out what would be the next steps once that bill did get passed, and didn't get a whole lot of input about what that would be. And after the bill passed, we started having conversations with Dr. Judy Theriault and Veronica Judy Cecil, and they were very gracious to meet with us. And we had and still are having ongoing meetings with them. It had been sort of like every 90 days. And really that we kind of educated them about as to what CPMs were, kind of very similar to what I just shared with everyone. And kind of was said, well, we'll think about it. And then as we kept following up, it was that this would be a part of an overall broader maternal health review that DMS was taking part in. And we have not been able to really get a lot of information as to what exactly all is encompassed in this broader maternal health review. One large piece of that we have ascertained is a postpartum affinity group that Kentucky was selected to participate in from CMS. And I know that there seemed to be a lot of excitement within DMS about being selected for that. And that is really the only thing I have heard about. However, that group, while it is very wonderful and what the work it's doing is important, it is specific to postpartum mothers who have active substance use disorder. And that would be outside of the scope for a certified professional midwife. So I have tried to ask several times about what else is part of this maternal health review? Is there anything beyond this postpartum affinity group? Because if it is just that group, that does not include CPM. So still hoping to get answers. I know Dr. Terrio is going to be doing a maternal health presentation at the May MAC meeting. So I think hopefully we'll find out more about what is involved in that maternal health review. Other times it has just been said this is not a priority. Commissioner Lee has I think used those exact words. It's just not a priority. So we're hoping that by having TACs make recommendations, maybe that will help it at least elevate a little bit to be at least a small priority.
Yeah, no, I appreciate that. Thanks for the background. Well, it looks like Dr. Terrio and Deputy Commissioner Cecil are on. Would either of you be able to give us some updates from DMS?
I think Mary Catherine did a good job of sort of describing how the interaction has been, and we certainly have appreciated the information that they brought to us. Medicaid generally, when it comes to covering a new service or a new provider type or anything new, it takes time. We have to ensure that we're there. There's a lot to it. There's the provider, the member, the system, regulations, state plan amendments. There's just so much to it, and this is fairly new. Newly covered by states. Not all states cover it. So we're learning. We're kind of in this learning process. And yes, Dr. Terrio does have it on our radar as part of kind of overall maternal health improvements that we want to make to the Medicaid program. So we are limited on resources, and COVID certainly pushed everything back. All the things that we had to do to implement COVID did have to, kind of push a lot of things on the back burner that we would certainly like to be front and center and work on a regular basis. That's kind of where we are. We do have now unwinding ahead of us. We have unwinding of the public health emergency. We have, just as Mary Catherine, I think, alluded to, just priorities that we have to try to determine, what can we implement and when can we implement it. But we do cover nurse midwives, so anybody that has the nursing degree, we already cover. But again, I mean, this would be an expansion of coverage. It's not that we don't see any merit in it, but we're just trying to make sure that we're, being thoughtful and intentional about how we would cover this type of service.
Yeah, thank you for that. I guess I have two questions. Is there a timeline with the maternal health review and what recommendations or next steps are going to come out of that? And then you mentioned looking at what some other states are doing that are already reimbursing CPMs. Are there particular states that you're looking at?
Dr. Terrio, do you know?
I believe Oregon is one, and I think Mary Catherine and Jason can correct me. Oregon and Washington, I believe, are two states that have been covering it for a while, as well as doula services.
As well as what was the last one?
Doula services.
Oh, they also cover doula services. Thanks.
And in terms of timeline on the maternal health, again, unfortunately, things we can't do things as quickly as we like. The deep dive that Dr. Terrio is doing, it is a comprehensive maternal health, so it's both pre and postpartum. So I don't know, Dr. Terrio, if you have a kind of a end in sight for, you know, what's going to come out of that review and the recommendations and implementation of those.
We are looking kind of at the whole picture. I know it's started with the affinity groups and looking at postpartum care. And as you dive into those things, it just gets bigger and bigger and bigger. We don't want to just focus on postpartum care and substance use disorder. We want to take a more holistic approach and look at all of maternal health. And so it's just made it like a snowball going downhill. And the more we look into it, the more, you know, it's like, oh, there's one more thing, there's one more thing. And so we do want to have an overall comprehensive program moving forward. And so that's part of the reason things are taking a little bit longer. So things like professional midwives are incorporated.
Yeah, we don't want to take a piecemeal approach either, because like I said, this will require a state plan amendment and regulation change. And I know that sounds easy, but it's really intense. It's intense for resources and time. And when you open up a regulation, you certainly want to try to be, you know, as inclusive as possible of the changes that we want to make. And again, we know that there will be changes that will come out of what Dr. Terrio is doing. And so, you know, we just have to continue to ask for patience and understanding as we work through that.
So are you anticipating like a number of changes occurring at once so that you're opening regs one time and doing one SPA that incorporates a number of these changes?
Yeah, I think that's definitely
what you're thinking.
Yeah.
Okay. Well, that's helpful. Are there questions from our TAC members? Or comments? Mary Catherine, one other question I had for you. You know, I think at least for me and probably for many people, the difference between a certified nurse midwife and a certified professional midwife is not always clear. And I even like stumble over saying certified professional midwife because I want to say nurse. And so can you give us a little bit of a comparison, but how they are similar and how they're different?
So a certified nurse midwife is a nurse who then goes on to get further education in midwifery. So they are trained in the two distinct professions of nursing and midwifery. A CPM, a certified professional midwife, is someone who did not go through the nursing pathway first. They entered directly into midwifery as their profession. So they're only a midwife. The nurse midwife is licensed as an APRN in Kentucky, so they have all the privileges that come with the scope of practice of being an APRN, such as being able to write prescriptions and whatnot. The nurse midwife has a broader scope in that they would care for someone basically from the age of puberty through the end of life, really. So from the beginning of their reproductive cycle all the way on, they would potentially be able to care for someone sort of as a primary care provider, although they typically focus on the childbearing years in that midwifery part. For a CPM, a certified professional midwife, their scope is much more narrow and it focuses really just on that childbearing cycle. So from the prenatal care through about usually 6 weeks postpartum is when they are actively caring for the mother-baby dyad. They might provide some preconception counseling, but it's really focused on that childbearing cycle, whereas the nurse midwife would care for people potentially for a broader scope of time. The certified professional midwife, the non-nurses, they do not have prescriptive authority. They said don't write prescriptions. So they're not someone who kind of could act as a primary care provider. They would just be that perinatal care provider, so around the whole process of pregnancy and birth.
Thank you, that's helpful. And am I right that the nurse midwives don't actually provide births in homes?
They can, in Kentucky, they can. It's not generally their wheelhouse. They don't do their clinical training typically in a home birth setting. They have to they usually get their clinical training in a hospital. So that is where they are most comfortable oftentimes. Some of them will go out and seek additional experience working in the home setting because it is different. It's a different resource setting. You have to be prepared in different ways. Whereas if you're in the hospital, all the equipment is there for you. If you're going to a home birth, the midwife comes in bringing all the equipment with them. So we have maybe currently about 6 out of about 100 licensed nurse midwives, about 6 of them in Kentucky right now attend home births. And it's a lot of reasons why a lot of them just choose not to. Some of it being just because, like I said, they're not comfortable. They haven't gone out and sought the additional training to feel comfortable doing births in the home setting. Whereas the CPMs, they do their clinical training in the out of hospital setting. So that is more of their wheelhouse and where they are comfortable. Of those 6 nurse midwives who currently do see clients in the home birth setting in Kentucky, I believe there's 2 that are currently participating as Medicaid providers. They, of course, can choose to enroll and do that. So for various reasons, only 2 of the 6. So, and they're, I think, both in the kind of the central and northern Kentucky area. So there's a lot of people that, even though nurse midwives are covered, they don't have access to that care in an out of hospital setting.
Yeah, that's what I was wondering, what is the status of access to these services and the choices that people have. So thank you. Any other questions? We can discuss later, a recommendation around making CPMs Medicaid eligible providers. But if there are no other questions, we can also move on in our agenda. Thank you again, Mary Catherine and Jason, for joining us. You're welcome to stay, of course, for the entire meeting, but I know that you may have some other things that you need to do. I had also gotten a message that the pharmacy director has another commitment and needs to jump off early. So I think we're just going to be kind of going backward on our agenda. So up to item 5 now, to talk about COVID tests and vaccines. So Dr. Ali, are you with us?
Yes, I'm on. Can you hear me?
Yes. Yeah, so we know that Medicaid is covering COVID tests and, of course, vaccines. That's been the case for a while, but the information about covering over-the-counter COVID tests specifically, that was relatively new. We wanted to know how many, Medicaid members have taken advantage of these free tests, and if there's any other information that we need to be helping kind of get out there, because I think that that's a really important benefit that people should know about.
Yeah, so I'll start with the numbers. For the MCO population, we have 15,637 unique members who have taken advantage of the COVID tests, and that's from the time that we made it available, January 15th to present day. And then fee for service is 219 unique members. In terms of getting the word out there, I think we've done a good job of communicating, and I think groups like this one have also gotten the word out there to our members, and it's been successful. We certainly want our members to take advantage of the COVID tests and test themselves appropriately to avoid any sickness and going out into the workforce and likewise. So I think we're on the right track with COVID. I know some others can speak more to the vaccination rates, but I know that, some of the MCOs are looking at strategies and incentives for pharmacies specifically to give more vaccines. But from a testing perspective, I think our intent has been met.
Thank you for those numbers. Just kind of doing the rough math, is that like 1% of the Medicaid membership? I'm actually surprised that the number is this low, but I realize we're also kind of in a downward trend at the moment, although it's about to tick upwards again. Just wondering if there are it would be nice to know, I guess, what ways people have gotten the information. And if are any other strategies that either DMS has kind of in mind or MCOs specifically.
Yeah, and one thing that I want to allude to is that, this is the number of unique members that have taken advantage of this, not so much the number of claims. So, these members could have gone back and gotten additional tests a month or two later. In terms of the communications that have gone out, our MCO partners have reached out to members themselves, letting them know that these tests are available. The pharmacies know, they have the responsibility of, letting the members know. And we've gotten a lot of pharmacies reaching out to us, asking questions and, trying to get these tests out to members. One thing I will say is that a lot of members might be getting tested at a doctor's office or an urgent care because they feel that, their symptoms are to the point where an OTC test might not, cover the viral load that they have, and, just the efficacy around the over-the-counter test to begin with. So, there are other options that members can take advantage of. So that might be contributing to the lower numbers that we're seeing.
Sure. Yeah, that makes sense.
Yeah, this is Veronica. And that's what I was going to emphasize is keep in mind that I think testing has become so accessible in various ways at employers, at schools, at, again, as Dr. Ali mentioned, at doctor's offices. And so people generally are still accessing those, through various ways. The federal government offered free, ship to your house tests, kits. So, I wouldn't, I know it sounds low, but quite honestly, I really feel like, people in need are accessing them and have them available. Could we always do a better job of communicating and outreach and education? Sure. I think we all acknowledge that, and we appreciate our advocates, our community organizations continually helping us with getting the message out. And we don't want people to forget that it is there, even with, in the United States and in Kentucky with COVID, we're seeing less and less cases. It's still here. It's still, we still have to be focused on it and keep people safe and covered. So certainly welcome, all efforts to continue to keep that education out there.
I think that's particularly true, Veronica, because we know that the Medicaid population has a lower level of vaccination with the general population. And, with the surge that we see coming, that other states are starting to experience, I do expect that there will be the need for more testing in Kentucky soon. And so just hoping that we can help to kind of keep getting the word out there, remind people, sometimes it's easy to forget, but now that there isn't free testing by the federal government anymore at, really convenient locations, which I don't know about other folks, but regardless of whether you had Medicaid or commercial insurance, those like Kroger locations and other, UK had a lot of free testing sites. Those were the most convenient for a lot of us. And so I think going to the doctor's office is sometimes something that people kind of avoid or put off because, it isn't that convenient. So having these free tests in people's hands, I think is going to be more important moving forward now that those testing locations aren't necessarily going to be operating anymore.
Right. And keep in mind, so each person can get up to 8 test kits a month. And so, people in the household may be using them. So, 25,000 unique people means that you've got more tests out there because they have access to 8 per month. So that, as Dr. Ali emphasized, that's not the number of claims. It's just the number of unique members that have accessed it.
Thanks.
Right. And to speak on to what Veronica and Ali was saying, in addition to those efforts of building the awareness and supporting our members with the free over-the-counter COVID tests, Anthem has actually also worked with our homeless shelters and has distributed 5,000 COVID-19 testing kits to them as well, to make sure that they're easily accessible for those that can't, seek those services elsewhere, maybe due to transportation and stuff.
And thanks, Victoria. Are those numbers included in what we just heard from, I'm assuming not,
No.
right?
Nope.
Those are separate.
That's just our individual outreach efforts as an MCO.
Thank you. 5,000, you said?
Mm-hmm.
Thanks. All right. Do any other MCOs want to talk about any of their outreach or communication efforts? The other question that we had here was just related to the COVID vaccine, and how many Medicaid members have now received a vaccine and how many are actually up to date, which would be, the 2 vaccines and the booster, or for some, maybe 2 boosters at this point.
Thanks. Someone else has that information.
The numbers,
Yeah, there we go. Yep.
we're still calculating them weekly, and I think we're seeing not a significant increase. It's around 40% for the Medicaid MCO population.
Do you have that number you said that was for the MCOs, not for fee for service?
All right, fee for service is around 65%. I'm going to find the exact email here in a minute, but I will get those specific numbers before this is over.
And that's fully vaccinated, is that right? Up to date?
Yes.
Are the outreach efforts still ongoing as far as MCOs offering
Yes.
incentives and during various events and things?
Yes, I mean, they're still doing that. They still have the incentives that they're providing to get the vaccinations.
All right, well, thank you for that update. Any questions from TAC members? All right. Well, we'll jump back up to the top, to item 3, Medicaid enrollment and recertification. Cover some of the topics that we have raised at past meetings. The first is the status of system issues that have been reported by connectors. There were a few things specifically related to emergency Medicaid, and I know that Miranda has been really communicating, I think, directly with DMS on that. Name changes that have been overridden, and some of those may have been resolved. Just wondering if there have been any system issues that have been able to be changed kind of at that systemic level. And then Medicaid discontinuances for people who did not move, didn't pass away, or request to be discontinued.
I unmuted myself and then immediately muted myself again. On the issues that the connectors have brought, all connectors have brought to us, we have worked those cases one at a time. We found one issue with some kind of a more of a systemic issue as opposed to a bug here or there, and fixed that. It had to do with notices going out talking about eligibility for QHP as if your Medicaid was going to end, but of course it did not. So that was corrected, and I think that we managed all of the calls that came in on that pretty well. Otherwise, as far as how I think that it's happening, I don't think anybody's getting discontinued who did not move, pass away, or request. And if that happens, I need to know about it so we can check and see.
You know, when we do open records requests, they come through the Kentucky Center for Economic Policy, but that
Right. Okay. And,
there are
and what-
some,
there's a report, right? Correct. That's a report that comes out of the system. It's a canned report. The people who do the open records request, they ask for that report and now it's sitting there and they run it. Okay. Those are the people who would be disenrolled and terminated. And those are the reasons that they would be terminated for, were it not for the public health emergency.
so those aren't discontinuances, those are suspended discontinuances. Is that basically what you're saying? Okay, because there is also it includes discontinuances for death, moving, etc. So that's a little confusing. But I was also going to mention, you know, Christine, one of our TAC members, was discontinued. And I know you assisted with that case.
Well, but she wasn't really discontinued. She got a notification that she is discontinued. And then she was discontinued whenever people started to talk about the case. Okay, that was a communication error. That notice that she got was an error. And that's the notice I talked about when I first said we had some issues with a notice going out talking about people being eligible for QHP and that their Medicaid was going to end because of that. We fixed that. And the reality was that Christine was never discontinued until somebody misunderstood somewhere. I do not know. And I know Christine told me that she was there when her sister spoke to the caseworker. Okay, and the case and the sister never said anything about discontinuing, but somebody on the inside heard that and put it in the case record that she asked to have her case discontinued. Okay, and that's why it was.
So you don't think that a similar issue could be happening for other people who call in for various reasons to report an update, whether it's an update that they've moved from one county to another or changed jobs and have different income? Like, could that not be happening in other cases?
So let's recognize that nothing is 100%.
Right.
There's human error, there's system error, and what's most important is that if this happens to somebody, that they reach out, that it's brought to our attention so that we can make sure that, that it's fixed. Again, as far as we know, the system is working to not discontinue somebody if they haven't done one of those three things: moved out of the state, passed away, or have requested it specifically. But, you know, we're all going to acknowledge that nothing's 100%. Sure. And we do our best to get to there, but we definitely need people to report. I mean, you know, try not to talk about specific cases, but if somebody gets a notice and they're concerned, certainly they should reach out so that we could clarify that, you know, that's an error and no, you weren't going to get discontinued.
Yeah.
And we apologize for the notice. You know, we're definitely concerned. I'll go ahead and take this opportunity to say that with any unwinding that comes with the public health emergency, we don't want people to panic. We don't want people to, you know, increase their anxiety or fear that they're going to lose their coverage, because what we do know is that most people will be able to be passively renewed. And we really should only be focusing our efforts on those people that we can't do that. And so, you know, we're going to all need to work together and try to work through all of the one-offs and issues that are going to come with that and focus on those.
Yeah, no, I think you're absolutely right that we want to make sure that we're focusing on people who do need to actively recertify and getting out good information. My concern has just been that, you know, people wouldn't necessarily know that they were incorrectly
That's correct.
discontinued,
Yep.
when they get that message and know to even reach out. So when we hear from whether it's, one or two or three people, you wonder how many other people may have gotten a similar notice and not known. And because it was kind of wrapped into what was going on with open enrollment and qualified health plans, I wondered if there could have been a few other people who were in a similar situation. But-
Usually, oh, I'm sorry. I thought you were done. I didn't.
No,
mean to-
I'm done. I was just going to say, if Miranda or Christine have anything more to add, it may be that you're right. This was just a fluke, and hopefully that's the case.
What I was going to add is that usually folks find out about the status of their Medicaid when they try to access services. And so they'll go to a provider or they'll go to a pharmacy, and either at the pharmacy, they have that point of sale check. And then the provider will also check usually on eligibility status. So there is a process for that. It's called the dire needs process. I know that some of you've probably heard about that, but it's a process that we have inside. It's an internal Medicaid process. Providers will call us, members will call us. The call center knows about the dire needs process so that we can correct things like that. And we have people who do that all day long. And so there are people that have the wrong eligibility status showing, and as there has always been. And hopefully we are able to address that when they go to access services, because that's where the people really need to know that they're eligible. I'm sorry, I have a cold or very bad allergies today.
I'm going to say everybody's got allergies right now.
I just want to say that I do appreciate, Lee, that you worked through the initial problem. Now I'm, and I'm just using me as an example that might be going on with others. So now that that's been corrected, there's been several documents that show it, but the dates on the documents aren't in sync. And so I'm not able to get a reimbursement for having paid the qualified health plan. But I'll work with Priscilla in Emily's office is now my connector. So I'll work with her to work through that. But thank you though for pushing it along. I appreciate it.
I'm sorry you're still having issues. And if you continue to do so, I don't know very much about the qualified health plan, but if Priscilla has an issue getting through, you just contact us and we'll find somebody for you to talk to.
Great, thank you.
Miranda, do you have anything that you want to add related to the emergency Medicaid cases that have been pending review? Have those been resolved?
The ones that the one that I emailed Lee guys about was resolved, and prior ones are it's not. So I did have another one pop up, and that's the one I emailed Lee about, but I got it resolved over the phone. So as far as I know, it's still happening, but I haven't had another one since that one.
And again, let me reiterate, it's never going to be 100%. And it's unfortunate. And trust me, if we could do something to make sure that nothing ever happens, an error never happens, I would do it in a heartbeat. What I think is great is that you guys reach out and let us know. And if it's systemic, we have to do, we have to make definitely have to do something to the system to correct it. If it's individual, those are going to happen. There will always happen. And it's just the communication that we have, with our connectors and with you all is what we need to have as the process as those pop up to try to help those members out.
Yeah, thank you. I think I'm wondering if the emergency Medicaid cases are somewhat systemic, if that is an issue that is happening more widely, but just would appreciate any digging that you all can do, since Miranda has had a few of those.
Yeah, and Lee could talk about this probably a little better. Emergency Medicaid is so individual, case specific, that probably complicates it. But Lee, do you know anything systemic wise, system wise, that is creating the?
Not that I'm aware of. No. One of the things that continues to happen, I think, overall, is every once in a while, some notices will get through. They'll get printed and sent out while we're doing part of the. Let me back up a little bit. Part of the process for the maintenance of effort requirement is manual in nature. And so every month there's some manual updates that have to be done. And some of those, I would say that emergency Medicaid is one of those audiences because of the size of it. And so you'll be happy to note that I've moved them way out now. So we shouldn't have any month to month or every 2 months or every 3 months. But every once in a while, the notices would print before the manual portion of the renewal got done. And I think that nobody should have been terminated, and nobody actually was. More often than not, it was the notice that went out in error due to the manual part of that process.
That makes sense. So it's particularly the notices that people would receive whenever you do that manual renewal.
Thank you for addressing that, Lee. Yeah, I think that was really difficult. The people kept getting those notices every couple months, so having it further out is better. The issue that I had seen that we brought up before at the last meeting, and I don't remember if you were there, Veronica, was about the often when I enter in a case on Connect that is for emergency Medicaid, the results screen just says it's pending review for 30 days. And if I call the CVS about it, they're like, oh, we don't see that there's an application actually. And so it's like, it's not really under any kind of review for 30 days unless we call about it. And so it seems like the screen isn't really accurate. And that was what I was talking about when I said I emailed Lee the last case, which I was able to resolve over the phone. And I was just notifying Lee that I had another one, but I haven't had one since. But I do worry about that issue.
Well, I was hoping that that was a one-off because nobody, I checked and nobody had seemed to think that that was an ongoing problem. So.
Right, that we don't have just emergency Medicaid applications sitting out there, nobody working them. We're not aware that that's a problem.
Well, I think that, it's definitely something I'm going to keep an eye on. I just haven't had another one lately, but it had happened a couple times in the fall, which is what made me think that it was an ongoing issue. And one of the things that I'll just flag as potentially being related is that I think a lot of connectors do not know that they can initiate emergency Medicaid applications through Connect. Like, it's not something that's been incorporated into the training or anything. It's just something that I need to look for because I work with that population a lot. But I think that more education for connectors and for consumers about emergency Medicaid will potentially increase the number of applications that are submitted through Connect for emergency Medicaid, which would also help us determine if this is a bigger issue or not.
Yeah, I was going to say, I feel like the majority of those applications are coming from hospitals and not from connectors like Miranda. And so that's probably why you haven't heard of it more, but I would guess that there may be some pending applications out there. I think we can probably move on. Miranda's shaking her head. The next item that we had here was the status of reviewing documents explaining the difference between presumptive eligibility and emergency time limited Medicaid. That was the flyer that Kentucky Equal Justice Center had put together. And I believe it was approved by Medicaid, but what we didn't know was how it was going to be used. and when?
I apologize, but I don't know if we've had that further discussion. Certainly, I think it was anticipated that you all could utilize that in your outreach and education, but I don't know, and we certainly chime in if we had come up with an actual plan on how we were going to communicate that.
No, I don't think I have anything to chime in on that with. I'm sorry.
Okay, well, we'll take that back.
We've been told in past meetings that it's under review, so that's why we keep it on the agenda.
Oh, okay. I thought under review probably meant the actual review of the document, but if there's, if you all, that's okay. If you all,
I mean, I'm trying to think too. Back on our other previous conversations, Miranda, do you recall what we thought the status was?
Yeah, for the brochure that we had drafted that explains emergency Medicaid and hospital charity care programs and FQHCs, like my understanding was that we were okay to use it, but that we hadn't heard anything about you all putting it out, and that's something that we were really hoping you all would be willing to do, DMS would be willing to do, is put out that information because it's really needed. And the more agencies putting it out, the better. But I was actually thinking that brochure that we worked on doesn't necessarily, I was trying to pull it up to look at it. I was trying to remember if it actually includes PE or if that was something else we were requesting separately.
I think that it did, but yeah, we can go back and revisit that, Miranda, after this meeting. But yes, I would just echo that, having DMS send it out at least to providers would be very helpful because it is providers who need to be educated on this. I mean, obviously the community members as well, but providers, especially in hospital systems, are the ones, basically initiating one of these two applications on someone's behalf. Most people in the community aren't initiating them on their own. And so, especially now that presumptive eligibility will only be possible, at hospitals or federally qualified health centers. So just making sure that people are going through the right application to begin with, I think would be helpful. The next,
I was just going to say providers and connectors, I think need this.
Connectors too. I agree. Yeah. The next item that we have here is the status of the diagram that DMS has been working on for Medicaid and Hcbs eligibility.
Hey, Aaron, can you let me share my screen, please?
Yes, give me 1 second.
Okay. Now I have to find how to get my cursor over here. There we go. Nope, I don't have it yet. There we go.
Have it now.
Yes, I've got it. Thank you. Oh, there it is. Can you see?
I don't see a document or anything.
Okay, let me try this one. Oh, I know what I did wrong. Hold on a second.
It looks like it's working now. Yeah.
Okay. Good. I think we finally got this finished. I want you to take a look at it to see if this is more what you were looking for.
I mean, on first glance, I really like the way that you have organized this, and I like the colors. That is a much more organized and simplified way of looking at eligibility than we've seen. Christine, this was your recommendation, so I'd be curious to hear what you think too. And of course, we'd love to get a copy of it.
It's hot off the presses, so yes, I'll give you a copy of it.
Yeah, the color coding and And, yeah, it does. First glance, it's easy on the eyes.
Lee, if you can send that to me, I can email it out to them.
Right.
It looks pretty comprehensive too.
Yeah.
I think so. I had one of our eligibility experts actually work on it, and she came up with some very nice information on here, I believe.
It would be helpful. The only thing that comes to mind immediately would be to just link to the current federal poverty level, or even put the table maybe at the bottom, like a separate table at the very bottom of this document, just so that people can reference that pretty quickly. But other than that, we'll take a closer look, of course, when we get it in email, but it looks really nice and I appreciate all the work you did on it.
So the thing about the FPL is, the amount is dependent upon your family size, your household size.
Yeah.
And so if we were to put an actual amount in here, we would have to say this is for single person. And so a link to
that table that is what I have in my mind.
Right. Okay.
This is Jeremy from Anthem. I was wondering if the MCOs could get a copy as well.
Well, once we give it to the TAC, it's public. So,
Okay, there you go. Okay,
sure.
Thank you.
I would imagine that we might post this on the website too. So, but thank you for asking. And yes, we will. Now I'm going to stop sharing my screen. Okay.
Great. Thanks, Lee.
Thank you, Erin.
The next item we have here is the status of adding those monthly reports on kids enrollment, which I did go back and look at whenever I finalized this agenda. So it might have happened between like last week and this week, but it still looked like it was October when I checked.
And there were no other reports up there, just that one?
Yeah, about a week ago. That was the case.
I don't know. We've had a complete failure of communication. That's not something I thought to go out and check, but I know that the reports are being run. I'll just have to take another run at it. I apologize for that.
Well, and it may be that they're up there now. I can check in here in a minute, but yeah, I knew that was the plan. I just wasn't sure when they would go up, and I've just been looking every once in a while. So I'll check and then send you a message. The next item we have here is the status of a fiscal study related to lifting the 5-year ban on covering legally residing pregnant women. Of course, this is something we've talked about a lot and made recommendations around, but the last recommendation, I think the response from DMS was that y'all were conducting a fiscal study. So just wanted to know if any progress has been made there.
I can say that we're very close to coming to a decision about this.
Okay. Would the decision be about doing a fiscal study or lifting the bar?
Lifting the bar.
Okay, thank you. And is it based on a fiscal study, or are you information that you can share?
Fiscal impact is always done when we make any change, period. We don't base our policy decisions only on fiscal impacts, but it has to be part of it because we have to pay for it. It has to be paid for if we increase the level of services for anybody.
Right.
And that would be an increase in the level of services by would impact adding additional enrollment. So we're very close to that.
Okay. So Lee, while we were talking, I did look at the webpage and it is still October 2021. It's not on the Medicaid statistics page at all. It's under, that right-hand menu.
Yeah, I know where it is. I'll find it.
Okay. Well, we'll look forward to getting more information about that 5-year bar. The next item we have here is the status of developing network adequacy one-pager or a decision tree of some sort that breaks down the steps that a person with Medicaid coverage could take when they're working, with an MCO versus when they need to go through DMS.
I have been discussing, I've talked to 3 out of the 6 so far regarding their current process and how this is working. I should have that complete with the other 3 as far as what their processes are looks like to make sure that we're addressing the network adequacy needs of our membership. I should have something hopefully by the next TAC that you can review and
Right.
go from there.
Thanks, that's great. Our next item is the status of the health disparities and equity TAC. I know that y'all were waiting on a member, I think.
We are, so we have 10 of the 11 recommended applicants that's being sent over to the governor through the regular process for appointment. We are still hoping to get, we're still searching for a member of lived experience and hope to have an applicant for that very soon.
Okay. I know I've already offered that, but if there's any way that we can help you identify a person, we would be happy to.
Thank you.
Yeah, the next item we have here is what it related to the public health emergency. I believe that you've mentioned having some stakeholder meetings to plan for communication and just, what that recertification process looks like with the unwinding that we talked about. Any updates there?
We are currently working on our operations plan that we need to submit to CMS, not for approval, but they're asking states to submit an operation plan for review. We're trying to create and finalize a project implementation plan. We this past week identified the stakeholders, from managed care organizations to community advocates. So some of you all will likely hear from us soon. We're probably going to be in maybe about 2 weeks, start kind of reaching out, because again, it's about us trying to get our ducks in a row and make sure that we know what decisions need to be made and what those decisions are, and then to bring in everybody to make sure we're covering everything. What we understand is that we have to have a communications plan, and that communication has to be to members and providers. It has to do with training for connectors and for DCBS staff. We also have lots of system changes, and those have been kind of looked at over the past month. All of the changes made at the beginning of the pandemic, we have to unwind. And so we're going back and looking through all those change orders and seeing what needs to be pulled back. And then the other bucket is the flexibilities that have been afforded through the public health emergency, and what needs to continue on through, that will be permitted to continue on through a state plan amendment or another waiver, or that are tied specifically to COVID and we can't extend those. We understand that communicating all that is going to be just very important. We're going to need everybody, all hands on deck, and making sure that everybody is kind of, staying on message and clear, understandable information. Again, probably in a couple of weeks, we'll start working on that. May 15th is sort of the 60-day time deadline for CMS if they're going to unwind after this current public health emergency extension. So we'll all be closely watching as that approaches to see what happens.
Right, that's when DMS would, or when CMS would notify states if they don't plan on continuing or extending the public health emergency again. And so, are you all feeling like, well, I guess it's not good to speculate.
I'd rather
I
not.
didn't even ask the question.
I appreciate it.
All right, well, that's good to know that you'll be reaching out to stakeholders soon. We appreciate that. Any questions before we move on to new business? So this is something we always ask, which is, how many Kentuckians are currently covered under the traditional and expanded Medicaid, as well as presumptive eligibility.
So, well, lost my cursor again. Sorry, I have too many screens open. I lose it. The number of expansion members is 601,637. So those are all, of course, adults. 601,637. Total members 1,634,241.
Okay. And do you have PE?
Yeah, hold on one quick second. I'm sorry. I thought I had the figure in my head, and then when I started to actually think about saying it, no number came to my mind. So give me just 1 second. It's opening. It's trying to open. I think we're in the neighborhood of 900.
About 900.
It's opening just up. There it is. No, yes. Oh, it's up this week. I guess I hadn't looked at this one. 1,500.
Thanks. And I think Miranda had a question last time about the number of Kentuckians covered under PE Medicaid in February 2020, or the average per month in 2019. Did I get that right, Miranda?
It does look strange. What I was trying to ask about was what was the PE coverage before
the pandemic?
Well, before, yeah, exactly, before the pandemic. Mhm.
Seems to me I have a memory of asking that question on a data request. Can you skip that question right now and
Sure.
let me look a little bit?
Yeah, we'll move on. I don't think this is related to that question. Just how many current PE enrollments were the result of applications submitted from the public facing portal, from providers, or from DCBS? We can skip that one too. The next item that we have on the agenda is our 1915 C waivers. Pam, are you on still?
Yeah, I'm still here.
Okay, fantastic. So we have a few things from our previous meeting that we just wanted to touch base on. The status of reimbursement for transportation assistance.
So we have included or transportation as part of the rate study for the look at formally expanding it to all of the waivers. Until then, we have verified that transportation can be provided as part of, for example, like the attendant care service, or some of those types of, there's a corresponding service in each waiver that would cover that transportation could be provided under, until we are able to expand it to all of the waivers. And also looking at, right now it's only a participant directed option, so we're looking at what the best way is to implement it, because honestly we have not had very many people in SCL use it. So
that's what I was going to ask next, and I'm wondering if it's because people don't know that that they can use it, or how to go about getting it approved. What does that process look like?
I think that's part of it. I think is that people just don't understand maybe the service or how to use it. We can So obviously there'll have to be regulation changes long-term for us to, depending on, as we review the services and look at, what the rate will be, there'll be, changes to regulations and to the waivers. Until then, we can do some just education just out to the providers to explain and remind them that it is covered under these services in the waivers right now, that they can use that until we're able to, make the changes to expand that service.
Yeah, I think that'd be helpful. Did waiver participants also get a communication? I feel like you.
And we can make sure that they get a copy of that, or that they get something about that. I'll follow up with Kelly too to see what we've done. So many, honestly, we've released so many things recently. I just need to go back and follow up to see if it was covered, and if not, I'll make sure we get something out.
Okay, Arthur, do you have any questions or any feedback you want to share related to that? I'll move on to the status of implementing the enhanced. No.
No question.
No questions. All right, thanks.
Something to ask. Yeah. You gotta. You got a document? ART? Yeah. ARC? Yeah.
Arthur, your assistant, I'm having a hard time hearing. Would you mind speaking up?
He said he had got a document from ARC.
Yeah. A document from ARC.
About what's gonna happen? With Medicaid? Ask him when it was over with. Over it. I can't catch that word, I'm sorry. Yeah, when 19. Yeah, when the 19 is over with. COVID is
19.
over.
What's gonna change when the pandemic is over?
It's supposed. It goes in you. Two. It goes into detail. On what's supposed to happen. So you have a document from the ARC and the document goes in detail about what's going to happen after COVID with Medicaid. Do you want me? Do you want me to send it to you? And you can.
Arthur, do you have questions about that document and what's going to change when the pandemic is over?
He said he thinks everyone should read it. He said, "May send it to you, and you can send it out."
Yeah, and I think it'd be helpful for us to take a look at that. And if there's anything specific that you have a concern or a question about, if you could just maybe give us some bullet points of what the issue is, we could ask Pam to weigh in on that.
So you make sure that I get that, because I'm not sure what the ARC may have sent out, because all of the flexibilities that we have for the 1915 C waivers, they run up to 6 months after the federal public health emergency is declared over. So with it just getting extended to mid-July, those will still go into place for the remainder of this year through next January. So and we'll start as time gets closer to that, or we know when for sure that it's going to be declared over, we'll send out more communications. But I'm not aware of what the ARC sent out. So if Arthur will share that with you and you get it to me, I'll look at it.
Yeah, we can definitely do some email communication about that. And if we need to, we'll put it on the agenda for our next meeting too. Yeah.
He said, yes, thank you.
Absolutely, Arthur. So in terms of the enhanced HCBS funding plan, are things going kind of into place now? Do you have things?
So we had been moving kind of full steam ahead with kicking off all of the other work streams, but with the passage of the budget and the direction in there for us to reach out to CMS to obtain approval to use that enhanced money for increases to provider rates. Everything has been paused with the exception of the rate study, and we are having to rewrite a spending plan. And we'll be putting that out for, it will go out for a short public comment period before we submit it. But we have basically everything is paused right now except the rate study while we are rewriting our spending plan and sending that to CMS for review and approval. And then we'll have to evaluate after that what can continue, or what will, if anything, we will have funding for.
Thank you for letting us know. I hadn't heard that. So you said there will be a short public comment period?
Yes, we are going to put it out for because timing is so, typically we put out It's typically 30 days we do for public comment, but because the timing of this is so critical in that we only have until March of 2024 to spend the money. So we probably will do a more abbreviated of like a 2 weeks plan for everybody to try to get to review it. We'll send out kind of some of the those quick reference guide type things that we do that really points out, here's the changes, so that it's not to facilitate review. But I don't believe it would be as prudent for us to hold it out for the full 30 days just because our timing is so critical with this in the timeline. But we do want there to at least be an abbreviated public comment period and let for people to be able to review and ask questions.
Yeah, we appreciate that.
He said he has a question.
Yes.
Is the rates shoe?
The rate study group.
He said, what did you say?
About the rate study, Arthur, is that your question? Okay.
Are they still meeting?
Yes. So the rate study work group is still continuing because we have such a disparity amongst the rates between the different waiver populations. And we know based on the work that was done in the prior rate study that did not get implemented is that there are rates that need to come up, that there are rates that are below what they should be. And that's even without this 10% increase in year one and 10% in year two. There were some rates that were over that amount that needed to be raised for them to be equitable and for them to pay for quality employees. So we are continuing with the rate study. We actually have our next meeting is going to be on Monday. And right now we have an abbreviated, it's a wage and rate survey that is out to the providers right now, where we did training on that on the 13th. So it's been out for about a week. And we're working with the providers and any questions that they have and to get that out. But that's a critical part that we are encouraging all providers to participate in that, so that we can understand how COVID has impacted them, what they did in response to COVID, and then what it truly what the costs are for employment and the training and all of those needed things, so that we get this right as we do this rate study.
May you ask? Is P&A? Is P&A supposed to get sick?
Participate in the rate study.
So P&A is part of the rate study work group, as well as we have someone from CCDD. There's a couple other advocates that are for brain injury on there, and then Emily, I believe you or someone that you have voted or volunteered in your place are also able to participate on that. And then we have been posting all of the videos to the YouTube channel, as well as the presentation, so that anybody can go back and watch them.
Pam, I really appreciate that you've been posting those videos. And yes, I was invited to participate, I assume, as representative of the consumer TAC, but Steve Shannon is also participating, just FYI, Arthur.
Right. We wanted to make sure that we had equal, presentations to advocate for members as well. We will, Arthur, as we get a little bit further down the road, we'll start. Right now, it is very technical. It's really been in the composition of the survey and teaching the providers, explaining exactly what to do. But when we get to a point that we start looking at the rates and start looking at the survey responses, we will hold some participant and just some general public kind of information sharing sessions when we have the information to do that.
Well, thank you, Pam. I know the last question we had was about feedback sessions to be scheduled for various stakeholder groups. I think that was, I put that on the agenda. I don't know if that was specific to the rate study or just the enhanced.
We will be, so we'll be having some as soon as we, now that we kind of stop and we're going to kind of regroup and do the new plan, but we will have, there had been sessions actually planned for this week and maybe last week, but we did have to, we paused those while we were kind of waiting to hear about, and for the budget to be finalized. And so we will resume those and we will have those as soon as we have enough information to share.
Okay, thanks.
Mm-hmm.
And Lee had to hop off for another call, but she sent me some numbers that I just shared with you guys. Can you see them?
Yes, I see these. Thank you. So this is, actually, I'm not exactly sure what I'm looking at.
I'm
looking back at
It
my.
looks like last year's numbers.
Oh, where it says regular QE users, is that PE? So assisters, that's how many assisters enrolled, the contact center enrolled, PE users enrolled themselves. I'm not exactly sure what the headers mean.
I'll get clarification from Lee and I'll email you guys for sure. And I will send this out to you guys via email as well.
Okay, yeah, that would be great information to have. Thank you. And where it says worker, contact center and worker, I'm guessing contact center would be the DCBS call center, but in worker, I'm not exactly sure how that would differentiate. But yeah, any clarification would be great. Miranda, anything you want to add?
No, this is awesome, but the clarification would help. Thank you so much.
And that does look like it's pandemic timeframe. So we're hoping we'll get that pre-pandemic too.
Exactly. Yeah, this is one of the questions. And then the other question was about pre-pandemic PE enrollment in general.
Yeah. Thanks very much.
Oh,
he said his egg's about to leave.
Okay. Arthur, your aid's about to leave. So would you be able to stay for enough time to do a recommendation or as many recommendations as we decide we want to put forward?
He said how long?
We can skip to that now if that would.
Okay.
Okay.
Alright.
Well, I have one recommendation in mind, just based on the discussion that we had about certified professional midwives. Are there any other recommendations that our TAC members would like to put forward? Okay, so my recommendation would simply be that DMS make certified professional midwives eligible Medicaid providers. Any questions, concerns, discussion we need to have before voting? You make a motion, Arthur?
Someone have to,
No.
oh, someone has to make a motion.
Well, Arthur, if you don't mind turning on your camera, because I do believe we need to see you for a vote. But if you want to make a motion, that would be fantastic, and then I'll take a second.
And I make some motion. That Medicaid pays for. Oh, that pays for midwives. Simple. Service.
Yeah.
Great, thanks, Arthur. A second?
I second.
Thank you, Miranda. All in favor, say aye.
Aye.
Any opposed? All right, motion carries. Any other recommendations? That was the only one that I had.
In the past, I believe we had already made a motion that DMS share the brochure on emergency time limited Medicaid with providers and connectors. And I don't know if we should make a motion again for that, but it seems like
I don't think it would hurt.
yeah. So I guess the motion is that DMS distribute the brochure on emergency time limited Medicaid to providers and connectors and have it publicly accessible on the website.
Okay.
I'll second it.
So Miranda, I'm going to say that you made a motion. You good with that? Christine seconds. Thank you, Christine.
Yeah.
All in favor? Did you have a question, Arthur?
Yeah.
Did everyone post? Oh, did everyone vote?
Yeah. No.
On the midwives motion?
Yeah.
Did everyone vote on the midwives vote motion?
We did. I'm sorry if we skipped you, Arthur. Did you want to vote for that or against that? Well, you made a motion. So you made a motion. Miranda seconded and the motion carried unless I misunderstood people's votes.
Yeah.
You didn't vote?
Yeah.
He said he didn't vote, but he voted yeah.
Okay, thank you. Gotcha now. I'm sorry about that. So then the next vote we have is the recommendation is DMS distribute the brochure on emergency time limited Medicaid to providers and connectors and make it publicly accessible on the website. Miranda made the motion, Christine seconded. So all in favor say aye.
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 Okay. Any opposed? And motion carries. All right. One more call for recommendations. I think we're good there. And we've bounced around a lot on the agenda, but we're almost done. We've really covered everything that I think you all see on your agenda. I added something under other new business right before this call because I got an email from someone who is doing key informant interviews as part of the Kentucky Medicaid quality strategy. So this is specifically about quality of services provided to Medicaid members. and they have to have a quality strategy plan. And so they've been interviewing various stakeholders. And whenever they interviewed me, I asked if they'd talked to any consumers. And they said, no, they hadn't. And so I offered, well, I chair the consumer TAC, and we could probably find some people who would be interested in talking to you. So they've asked for us to help find 3 to 5 people that would be willing to talk to someone about Medicaid and, related to quality of services. So I'm wondering if people would be interested in helping me find some of these consumers. And of course, Arthur and Christine, if you want to participate yourselves, I think you would both be great voices for them to hear. So I can actually send that as a just follow-up email too. I don't want to put anybody on the spot, but just wanted to make sure that I took this opportunity to let everybody know that that's something that we've been asked. Did you have a question, Christine? Yes.
No, I wouldn't mind participating as long as it wasn't super time consuming.
I think my interview was less than an hour.
Emily, if you don't mind if I add a little bit to that.
Yeah, please do. Please do, Angie.
Yes, Northern Kentucky University is helping Medicaid with our Medicaid managed care quality strategy. It's to be reviewed and updated at least every 3 years. We're working with MCOs on the language as well. Right now it has 5 goals, and basically the interview would not be more than an hour. That they ask your opinion about certain things of what the current quality strategy, how that's working and that sort of thing. So if you're willing, we can certainly, if you want to share Emily your information, or to me for that matter, I can send that to them to set up a time to talk to you.
Yeah.
Oh, anytime you want me?
No.
He said, let him know, please.
Okay.
Oh, 2-3 days ahead of time?
Yeah.
Thank you.
They'll probably send out an email to you for a particular date and times, getting your feedback on when you would be a good time for you to meet.
Okay.
So it wouldn't be more than, we wouldn't tell them the information today and try to set it up tomorrow. It would be up to you.
Well, I'll make sure that all TAC members get additional information and then connect with Angie and is it Gary? Angie?
Gary. Mhm.
Gary, yeah. So you all just watch for that, and thank you for your interest. Unless I missed something because we bounced around, I think we've covered everything. Anybody see something that we missed? Or any other new business that someone wants to bring up? Okay. So our next meeting will be June 21st at 1:30. And I believe we'll still be meeting remotely. Is that changing anytime soon, Erin? I know with the Mac, it may change, but.
I am using the new system now. As you can tell, I'm in here all by my lonesome. So I have worked out a few kinks. So if you want to put on your agenda for next time to vote about coming back in person, that we should be, I found a few kinks here and there as I've used them, but I think I've gotten most of those kind of figured out. I think the only hiccup we may have won't really pertain to Rolls TAC because we have some that are really large, just like the Mac. So as far as you guys are a little smaller in your numbers, so I don't think we'll have an issue getting everybody on that side of the table. I may have to sit over in the corner and take notes somewhere, but so if we can vote on that next meeting, we should be good. There will still be the option if people would rather call in. I don't know if some of you guys have to travel and would prefer not to do that. So we'll still have the Zoom link. I just hopefully might have some company with me in this big old room.
That's what I was gonna ask next. These can be hybrid ongoing,
Yes.
right?
Yes.
Okay, because I think that is, the accessibility of having a virtual option, I think is really helpful. So I appreciate you all getting the equipment that, will allow that to happen. So I'll make a note on the agenda that we can vote on this on June 21st to come back, or at least to have a hybrid option.
So I don't know about you, but if you didn't have to drive, I wouldn't want to, if I could just log in.
I mean, there's a lot of convenience in having the Zoom, and I've appreciated how it's worked to bring people from all corners of Kentucky together for a lot of meetings. Our next MAC meeting is May 26th, and I'll give the report there, but just always want people to know that is happening. And of course, just like, Pam was saying that recordings are going up about the DMS rate study, these TAC meetings are being recorded and shared on the YouTube page, as well as MAC meetings, if you ever want to check those out. I find, especially if you want to go back to a particular section or if you miss a meeting, it's a good way to catch up. So that's all we have. And I will take a motion to adjourn. If we even
A
do that.
motion to adjourn.
Thank you. I never remember if we actually do that. We probably shouldn't make a motion to adjourn, but we'll just go ahead with it. Can I get a second? Arthur, thank you. All in favor, say aye.
Aye.
All right. Any opposed? Motion carries. Thank you all. I didn't think we'd get through this in 2 hours, but we did. So
Thank you, Emily.
Thanks, everyone. Have a great afternoon.
Thanks.
Yes.
You too. Appreciate your help, Erin.
Go get some sun.